Very good morning, everybody. My name's Chris Needham. I work with Schneider Electric, and I'm what we refer to this week as a principal consultant working with our segment team. I'm formally 30 years in the National Health Service, so this has been a trip down memory lane for me this morning. It's really interesting. Brilliant presentations, thank you.
Okay, thank you. So if you'd raise your hand with questions, and the people at the mic will come and find you.
Sorry, I've got another one. Amazing, plenary. Thank you very much. I guess one statement and one question, Kim. Those 3 points are definitely things that resonate with me. I'm the Associate Medical Lead at Nuffield Health. We've got 37 hospitals and lots of gyms across the UK. And last year, we rolled out a dashboard for energy saving. And we set all of our sites a consequence, which was a positive one. Your sites will maintain their bonuses if you hit our 3% target of energy reduction. We fed back with measurement using a dashboard, which was kept up to date quite regularly, and gave a competitive element to all the sites. And then in terms of the sort of the results from that, we beat that target by 7%. We saw a reduction in our scope 1 and 2 of 16.5% just from that relative feedback, and that gets everyone talking. But we have a problem, and this is for Paul, in terms of our logistics and the fleet that we have that services our HSSUs and sterilisation units. EV won't really cut it at the moment due to mileage and axle weight. Have you had experience in using HVO as a bridge to EV? Do you think it's a worthwhile transition, or is it worthwhile just waiting until EV becomes more?
Depends on how deep your pockets are, really. HVO is much more expensive than diesel and petrol. You might be better off investing that money in elsewhere. It does cut carbon emissions. There's nothing for other air pollutants, though, and it is very expensive. And the credentials of some HVO sources are questionable, really. So we do know there are electric HGVs out there. We're trialling 20-odd 19-ton trucks, so it is possible, but they're not financially viable at the moment. I would say hang fire if you're really keen to tackle your transport emissions. That is something for the short term. And the great thing about HVO is it is a drop-in fuel, so you don't need to change any of your vehicles. But I think you'll find it pretty expensive, and you might find that there are more sensible investments that will get you a greater carbon reduction for that investment in the short term.
Thank you. This lady, and then there was another lady here afterwards.
Yeah, thank you very much. Ali Watson from NHS Kent and Medway again. So just some observations to the speakers. So to Paul, I have to say travel and transport is the one area we're really struggling to get traction on in Kent and Medway. In terms of leadership, we're really trying to work with local councils because they're the ones that influence the infrastructure for travel and transport. Although we've got a fantastic relationship with the council, we aren't getting that leadership. Also in terms of primary care, so how do we get patients travelling to their practices in very rural locations, that kind of thing. So there's lots more to be done in that area, and we have engaged with Andrew Bradley from the NHS team. So working with him on some solutions, hopefully. To Kim, great enthusiasm, passion, love it. Need to see lots more of that. But I feel we do need some mandated targets from NHS England in terms of must-dos, because we're struggling as an ICB to really have that stick. We're working a lot with carrots, but have no sticks. The Des Lorraine decommissioning, brilliant, and I think that's an example of how that works. So we do need more of that, please. And to Pete Waddingham, I work very closely with Amelia James, fantastic Amelia James. We have set up a brilliant network in Kent and Medway, looking at how we work with academia and how we embed research findings and how we bid for SBRI funding as a system, that kind of thing. So we do have some really good learning examples. Very happy to talk to any of you about what we're doing in Kent and Medway.
Thank you.
Was there any questions in there?
Just one more. Can I just say, some of you were talking about AI. Could AI help with things like designing systems that are more green-friendly, ultra-lightweight, like pods, like hospitals, like places where people are in pods? you know, you don't have to be in a fixed building. Can it give like abstract things? It can create new things like new materials, or is that, I mean, could it be out of scope for green policies, if you know what I mean?
It's an interesting one. I think where AI is good at the moment is just where it's got a lot of data that it can kind of interpret. I mean, travel's a good example. You know, we at the Green Hospital, we had travel and transport as a theme, but you know, making people's journey in the most slickest, quickest way possible, using a lot of data and where they want to go and what, you know, that lends itself. I mean, there was kind of an observation about, you know, patients and travel. It's difficult because we all make the easy choice, don't we? But I used Uber for the first time in about a month ago, and I know it's been around for a while, but that makes sense, doesn't it? You know, you get in a car that's the nearest to you, you kind of put where your location is, and then you can now pick if you want a green one, a small one. You know, that's an example of where data and some of the things are combining. Can it start predicting, you know, alternative materials? It probably won't be long before it can. I genuinely think if you do take the time to absorb yourself in AI, you'll be blown away by what it can already do today. So I think the world's the oyster, really.
I wonder if I can just build upon that point. Yes, in answer to your question, there are solutions now that are looking in terms of alternative scenarios for building construction, etc. We are actively using artificial intelligence, machine learning, in terms of interpreting vast amounts of data around estate performance, sustainability targets, etc. So those systems exist, and they will only become more prevalent. Our focus is heavily in that area. For example, I'd be very happy to have a conversation with you a little bit more about that. But absolutely, yes, in answer to your question, AI is absolutely where the focus is right now.
Just quickly, I think everyone's kind of covered it, but there was a fantastic case study a couple of years ago. I think it was Oxford. I'm looking at Paul because it was on travel and transport, I'm not sure. And it was about ambulances using AI technology. Obviously, it's come on a lot since then, but essentially they were looking at traffic lights in the city and looking at the timings, and they managed to reduce the time that it took for ambulances to get to their destination because they were working with the traffic light systems. So it's just like really simple stuff like that suddenly becomes much easier with AI. So yeah, I agree with everyone else and just thought that was an interesting case study.
Thank you. So one question at the back, and then I'm determined to get you your question next.
Thanks very much. Can you hear me? Oh, there we go. Brilliant presentations, thank you. I'm Rachel Surtees from UCL Partners. We're one of the HSNs in the network that Pete was talking about before. I've got a question for Paul. I was really struck by the hospital that's funding the travel for staff. And on one level, how innovative, and a hospital that's willing to work outside of its scope to do whatever it takes. But I wonder how much risk there is in hospitals stepping into spaces that arguably government should be filling to make transport affordable, attractive for people to be able to work into. And without getting political, in your national role, like how much of it is about that lobbying and advocacy into government for infrastructure and impact of that space, and how much is about moving, kind of giving autonomy into local regions to do whatever it takes, even if that does mean filling holes?
We're pursuing all routes simultaneously. Actually, the government don't really have that much interest in bus services. They're privatised now, really, so it's working with those bus providers. Quite often they will fund that because they see a business opportunity. As I said before, NHS could be a massive market for those bus services that have seen their ridership depleted over COVID, lots of staff, lots of patients and visitors, so it makes good commercial sense for those. Where hospitals are investing in these services, it's not going to be forever. It's a try and switch the dial, often because they might need the land. You know, there's lots of examples now where trusts need to build bigger A&E departments, for example, more imaging, and the only land they've got left to them is car parks, really. So they'll build on that, and they'll need to create other alternatives for people to travel in another way. It's not necessarily about carbon or air pollution. It's just a pragmatic solution about we're going to have fewer car parks, and then what we're going to need to put in place so that our staff can still get to work. And that's okay, as Kim said and Pete said, it's about working with a range of different motivations to reach the same outcomes. But yeah, we're pursuing every angle we possibly can.
Could I just sorry.
Sorry.
Could I just perhaps ask a question on that a little bit, Paul? I think part and parcel of the problem, and I experienced green transport planning and working with local authorities and those sorts of things in the past. So the same conversations were maybe 10, 15 years old without taking anything away from what's happening now. But is there something about joining together in order to bring some more momentum to it? Because each of the health organisations are dealing with these things locally with the local authorities, and they have their own priorities. Is there something about creating some more momentum by connecting organisations together?
Absolutely, and we've got a massive opportunity now with the advent of integrated care systems. They're anchor institutions. They include local authorities, statutory members, and many others. So in some parts of the country, not in all parts of the country, but in some parts of the country, that collaboration at that level will pay far bigger dividends. In other places, the transport solutions will have to be intensely local and will have to be planned on a smaller footprint. But yeah, and again, just part of the all-encompassing approach that we're trying to take to provide as many incentives as possible and as much action as possible on all scales. Really.
Okay, we're out of time, but I did promise, so can we have this one last question, and then everyone gets a 10-minute, well, it might be 8 minutes by then, comfort break, and as I said at the beginning, I'll have to run off, but I'll see you all at lunchtime. So.
Thank you. Yeah, Cara Chambers. I'm the Sustainability Manager at East Midlands Ambulance Service. So firstly, Paul, you've stolen all of my thunder for my presentation later. But, so we'll have to talk about that later. But one of the things that's come out through all of the presentations, both this afternoon, well, this morning and earlier this morning, is the importance of data and how key data is to kind of drive the business case and evidence that. But getting that data often comes with a cost, and then at the end of that you need somebody who's got both the skill set and the time to analyse it. So how do you write the business case to get the data without the data to support the business case to get the data?
I mean, I'm kind of regretting promising you that question. Does anyone want to take that?
I would just add a quick point, because I was going to make this on the last one, but there was an organisation that we were working with and showcased last week called Mobility Ways. They were using data, mapping it, and a bit like what you said, Paul, now these organisations are commercial. With that data, people can put the business case together because they can see where does it make commercial sense to change the bus routes, to add ones that are missing, etc., etc. I think, you know, it is, again, I don't want to labour the point about sort of AI, but we've got to think data can be complicated and costly to do, but there are cheaper ways of doing it and more convenient ways of doing it. And I think maybe just step back and reflect, you know, how costly is it going to be to get this data? Are we thinking creatively?
Yeah. Sorry, Paul.
Also, the NHS is a big fan of paying for the same work several times, you know, over multiple trusts, exactly the same, change the header on the slide. It's possibly the same for ambulance trusts, so if you're wanting to do something, speak to us, because we might not be able to have the answers, but we might be able to work in such a way that we commission that work once for the 10 ambulance trusts rather than each person paying for the same work over and over again. So, yeah, speak to us first, I guess.
And I think we also really like doing work that other people have done as well. So Nuffield Health, maybe we need to talk to you about some of the data that you guys have got so that we can use that to then build a business case for ourselves.
Okay.
And technology partners who are already doing it as well would be useful.
Okay, thank you very much. Sorry for my time management for the second time.